March is Colon Cancer Awareness Month.
Joining us this morning from UK King's Daughters, we have gastroenterologist Dr. Michael Canty. Good morning, Dr. Canty. So tell us what age you should begin those colon cancer screenings.
Well, certainly for the average risk patient, it should be age 45. For those who are higher risk, we should consider earlier ages, indeed age 40, and sometimes even earlier if someone has a very strong family history of colon cancer. But for the average risk asymptomatic patient, the standard of care at this time is age 45.
And what type of screening options are out there for us?
Well, again, certainly in terms of the average risk patient, the options fall under the heading of a one-step procedure, and that's defined that's the colonoscopy, or two-step procedures, and that includes the fecal test, the FIT test, fecal immunochemical tests, multi-target stool DNA tests such as the Cologuard, as well as flexible sigmoidoscopies, CT colonographies, which is a high-tech CT scan of the colon, and in some parts of the world, not as much in America, a capsule endoscopy evaluating the colon. But again, the gold standard is indeed colonoscopy, but that is invasive. The cost, the need for a prep, certainly that sways some patients away from that. And so we very emphatically state that for a asymptomatic average risk patient, defined as someone who doesn't have a family history, who's not having any symptoms, some of the non-invasive tests are reasonable options to pursue. Indeed, at the end of the day, our approach, our concept, our belief, if you will, is that the best screening test in the asymptomatic average risk patient is the one that's done.
Is there a higher risk for getting colon cancer if you have family history?
That is indeed the case. If you have a family history, your risk of colon cancer is at least twice that of someone who does not have a family history. And if you have multiple family members with colon cancer, your risk of getting colon cancer could be as high as 4 times those patients who don't have family history. So having a family history indeed is the highest risk factor, if you will, for colon cancer. That genetic risk factor increases your risk anywhere from 2 to 4 times. There are other risk factors, but at the top of the list for risk factors is indeed family history.
What are the symptoms? What should we watch for colon cancer?
The reality is this. The most common symptom of colon cancer is indeed is to not have any symptoms whatsoever, and that's the scary part, and that's why there's such an emphasis on screening. When we find these small colon cancers or advanced adenomas, that is polyps that are almost cancer, many of those patients are totally asymptomatic. So I come back to the point that the most common symptom of colon cancer is to be asymptomatic. But if in terms of classic symptoms as we define them, obviously blood in the stools, having abdominal pain, having unexplained weight loss, being anemic, having any marked change in your bowel pattern. If you were normal and regular most of your life and all of a sudden now you're very constipated, or you're having diarrhea for the first time, those are symptoms. And indeed, what I tell my patients is to listen to your body. If things are changing, listen to your body. And hopefully it is the common things, you're eating the wrong things that disagree with you, but all too often anymore, we find serious pathology. So if there's a change, again, it's time to get things checked out.
In the last year or so, we've heard of more younger people in their 30s and 40s getting colon cancer. Is this the case for here in our region?
Very definitely, it is true. Again, unfortunately, stating, I guess, acknowledging my age, I've been doing this for a long time, and indeed since 1987. And the single thing that concerns me is that is all the young people that we're seeing. 38, 40 years ago, it was unusual to see young people under 50, under 40 with colon cancer. Sadly, we see that all the time now. Indeed, under age 50, the #1 cause of death from cancer anymore in men is colon cancer, and it's like #2 for women. If you look at colon cancer over all ages, there's actually been some slight decrease in older people like myself because we've been getting screening since we've been in our 50s, and we're seeing the benefit of colon cancer screening. Where we're seeing a rise in colon cancer, not only in terms of the incidence of colon cancer, but in terms of deaths from colon cancer, are in the young population, people under 50. And so, yes, we are seeing a disturbing rise in colon cancer in younger and younger people. As a point of reference, the youngest patient that I've had with colon cancer in the last year or two was 30 years of age. The youngest patient that I've had with a precancerous polyp in the last year or so was 19.
So if someone is wanting to get a screening, how do we even go about scheduling a colon cancer appointment with you all?
UK King's Daughters Medical Center Gastrointestinal Group, Gastroenterology Section, we have open access screening. You can call several numbers that are available. Area code 606-408-8200 or 606-324-3188. And people answering those phones will be very helpful in terms of getting you tied in for screening, or if you're symptomatic, rather, we'll get you in to see one of our clinicians and get you set up.
All great information, Dr. Canty. Thanks so much for joining us.